As you may be able to tell, I'm feeling a lot better than I was last week, but this week's video is all about my treatment. Treatment for sacral chordomas are limited. The gold standard is surgery to remove the tumour followed by a course of radiotherapy. However, going down the surgical route would leave me with lifelong changes, which would in turn affect my quality of life. Those side effects would be dual incontinence, so a loss of bowel and bladder control, sexual dysfunction, and of course, as with any spinal surgery, a small risk, but still a risk to my mobility. So even though surgery is the only definitive way to get rid of chordoma, after discussions with surgeons and oncologists, given my age, we've explored and decided to go for something known as proton beam therapy. Proton beam therapy is a stronger, more targeted form of radiotherapy. It's relatively new to England. I believe the first patient was treated over here in 2018. Before then, people would go to the States for treatment. PBT is only performed in, I believe, 2 hospitals with the NHS in England. There's one in Manchester and the other is in London. I'll be heading to London for my treatment, which, if you know me, is great as it's home to the West End. The aim of using PBT is to hopefully stop the tumour from growing and the cancer from spreading any more than it already has, and possibly even shrink it enough to get off the nerves, therefore to get me out of the pain that I'm currently suffering with. But going down this route isn't going to make me cancer free. The tumour's still going to be there, but it'll allow me to go back to work and allow me to live as a regular 24-year-old, pushing my limits and living life to the absolute fullest before the treatment wears off and I undergo the surgery in about 10 or so years' time. When discussing treatment, we had to discuss fertility, which for someone like me, who wasn't at the point in their life where they were thinking about settling down or thinking about having a family, was quite an overwhelming conversation, because these are the choices I'm going to live with. I had to make choices for my future. As some of you know, if you watched the last video, I was up in London a couple of weeks ago and had an ovarian transposition surgery. I had that to maintain my hormone function during treatment and afterwards, so that will still be working, and to preserve my eggs in my left ovary. Because we do believe that the proton therapy is going to destroy my right ovary and my uterus is going to become unusable. That obviously limits my options going forward. Miracles do happen. There's still a chance I can carry a child naturally, but I have been told that I need to prepare myself that in my future, when I'm at that point and I'm ready to have a family, I'm going to need to explore other options with IVF, surrogacy, things like that. So far, what I know about my treatment is I will be in hospital for about an hour a day, every day, Monday to Friday, for 2 months. They're providing us with an apartment up in London to save us from travelling up and back every day, because it's just not feasibly possible. And by them providing it, it's giving us one less thing to worry about whilst I'm going through treatment. I don't know everything about it yet, but I'm actually up to London next week for my consultation and consent meeting, as well as my scans, which involves 2 CTs and an MRI. That way they can map my treatment and completely plan it. I'll be able to ask all my questions then, and I suppose I can fill you in more next time.